Question 1. A CNA is assisting a resident with dementia who repeatedly asks what time it is, even after being told. The best response for the CNA is to A. Gently remind the resident that they just asked and were told the time. B. Provide the time clearly and calmly each time the resident asks. C. Place a large clock in front of the resident and point to the time. D. Ignore the question after the first few times to avoid reinforcing the behavior. Answer: B. Provide the time clearly and calmly each time the resident asks. This question tests understanding how to best respond to repetitive behaviors in residents with dementia. The keyword repeatedly asks indicates a common manifestation of memory impairment, not a willful action. For residents with dementia, it is best to provide comfort and reorientation calmly each time, as their short-term memory makes it difficult for them to retain information, and ignoring or correcting them can cause distress. For example, if a resident asks about lunch multiple times, gently tell them it will be served soon each time. Remember, patience and consistency are key when caring for individuals with memory loss, as their reality may differ from yours. Question 2. When documenting care, a CNA makes an error. What is the correct procedure for correcting a handwritten entry in a resident's chart? A. Erase the error completely and write the correct information. B. Use correction fluid or tape to cover the error and write over it. C. Draw a single line through the incorrect entry, write error and your initials, then write the correct entry. D. Rip out the page and rewrite the entire entry on a new page. Answer: C. Draw a single line through the incorrect entry, write error and your initials, then write the correct entry. This question focuses on proper documentation procedures, specifically correcting errors in a handwritten chart. The most important concept here is maintaining the integrity and legal validity of medical records. You should never erase, use correction fluid, or remove pages because doing so can make the record appear fraudulent and obscure original information. Instead, drawing a single line through the error while keeping it legible, marking it as an error with your initials, and then writing the correct information ensures transparency and accountability. This method allows anyone reviewing the chart to see both the original entry and the correction. Question 3. A resident with a feeding tube becomes restless and pulls the tube out. What is the CNA's immediate action? A. Reinsert the feeding tube immediately. B. Offer the resident a glass of water. C. Notify the nurse immediately. D. Document the incident in the resident's chart. Answer: C. Notify the nurse immediately. This question assesses the CNA's role in responding to a critical situation involving medical equipment. The concept being tested is recognizing a situation beyond the CNA's scope of practice and the importance of prompt reporting. A CNA is not trained or authorized to reinsert a feeding tube, which is a sterile and delicate procedure performed by a licensed nurse or physician. Offering water could be dangerous if the resident has swallowing difficulties or aspiration risk. While documentation is important, the immediate action is to ensure the resident's safety and proper medical intervention by alerting the nurse. For instance, if an foreline becomes dislodged, the CNA must also alert the nurse immediately, as this is outside the CNA's responsibilities. Question 4. Which of the following is an example of objective data that a CNA would collect? A. Resident states, "I feel nauseous." B. Resident's skin is warm and flushed. C. Resident complains of sharp pain in the abdomen. D. Resident reports feeling dizzy when standing up. Answer: B. Resident's skin is warm and flushed. This question distinguishes between objective and subjective data, a core concept in observation and reporting. Objective data refers to information that can be observed, measured, or verified by others using their senses, making it factual and measurable. Phrases like warm and flushed describe something you can see and feel. Conversely, options A, C, and D are examples of subjective data, which are symptoms or feelings reported by the resident that cannot be directly observed or measured by others. For example, if a resident has a rash, observing its appearance is objective data, while their complaint of itching is subjective. Always prioritize observable facts when collecting objective data. Question 5. A resident who is normally very social and active suddenly becomes withdrawn, refuses meals, and spends most of the day sleeping. The CNA should primarily be concerned about A. The resident developing a new preference for solitude. B. The resident experiencing a change in physical or mental health. C. The resident needing more comfortable sleeping arrangements. D. The resident testing boundaries with staff. Answer: B. The resident experiencing a change in physical or mental health. This question tests a CNA's ability to recognize significant changes in a resident's condition, which is a crucial aspect of their observational role. The keywords normally very social and active juxtaposed with suddenly becomes withdrawn, refuses meals, and spends most of the day sleeping indicate a clear deviation from the resident's baseline behavior. Such abrupt and noticeable changes are red flags that could signify an underlying physical illness, depression, pain, or other medical issues, requiring prompt reporting to the nurse. For instance, a sudden decline in appetite or increased fatigue could be a sign of infection. It is vital to report any significant shift in a resident's usual pattern to ensure their well-being. Question 6. When assisting a resident with a weak right side to walk, the CNA should stand A. On the resident's strong left side. B. Slightly behind the resident, directly in the center. C. On the resident's weak right side. D. In front of the resident, leading the way. Answer: C. On the resident's weak right side. This question pertains to safe ambulation techniques, particularly for residents with unilateral weakness. The concept is about providing maximum support where it's most needed to prevent falls. By standing on the resident's weak side, the CNA can offer immediate support and balance if the resident begins to lose stability or stumble on that side. Standing on the strong side or directly behind offers less effective immediate intervention for a fall originating from the weak side. For example, if a resident has left-sided weakness, the CNA would walk on their left, providing a stable presence. Always position yourself to best support the resident's greatest area of need. Question 7. A CNA is assigned to provide incontinent care for a resident. After assisting the resident, the CNA should first A. Document the care provided. B. Wash their hands. C. Change the resident's bed linens. D. Offer the resident a drink. Answer: B. Wash their hands. This question emphasizes the critical importance of infection control practices, specifically hand hygiene. After providing care, especially incontinent care, which involves potential exposure to bodily fluids, hand washing is the absolute first step to prevent the spread of microorganisms. This protects both the CNA and other residents from contamination. While documenting, changing linens, and offering drinks are all important tasks, they must be done after proper hand hygiene to break the chain of infection. Always remember that hand washing is the single most effective way to prevent the spread of infection in any healthcare setting. Question 8. Before administering any personal care to a resident, a CNA should always A. Check the resident's vital signs. B. Explain the procedure to the resident. C. Obtain permission from the resident's family. D. Administer pain medication. Answer: B. Explain the procedure to the resident. This question addresses the fundamental principle of resident rights and dignified care. Explaining any procedure, even routine personal care like bathing or dressing, respects the resident's autonomy and right to know what is happening to their body. This approach helps to build trust, reduce anxiety, and gain cooperation, especially for residents who may have cognitive impairments. Checking vital signs, obtaining family permission, or administering medication are either not universally required before any personal care or are outside the CNA's scope of practice. For instance, before assisting with dressing, you would explain, "I'm going to help you put on your clothes now." Always communicate clearly and obtain consent before proceeding with care. Question 9. A resident frequently tries to get out of bed unassisted, despite being identified as a high fall risk. The most appropriate initial intervention is to A. Apply a restraint to the resident. B. Place a mat on the floor beside the bed. C. Engage the resident in an activity or conversation. D. Elevate all 4 side rails on the bed. Answer: C. Engage the resident in an activity or conversation. This question focuses on fall prevention strategies and the principles of least restrictive interventions. The concept is to address the underlying reason for the resident's attempts to get out of bed before resorting to physical restraints or barriers. Often, residents try to get out of bed due to boredom, anxiety, needing to use the restroom, or simply forgetting their limitations. Engaging them offers distraction, meets their potential need, and preserves their dignity. Restraints and full side rails are considered restraints and should be a last resort, used only with a doctor's order and when less restrictive measures have failed, as they can increase agitation and fall risk. For example, if a resident is trying to get up, you could ask, "Are you feeling restless? Would you like to read a book or listen to music?" Question 10. Which of the following observations would be most immediately concerning for a resident who recently had surgery? A. Reports of feeling tired. B. A slight increase in appetite. C. Redness and swelling around the incision site. D. Requests for more blankets. Answer: C. Redness and swelling around the incision site. This question tests a CNA's ability to identify signs of potential complications, particularly post-surgery. The keywords most immediately concerning point to a symptom that could indicate a serious issue requiring prompt medical attention. Redness and swelling around an incision site, especially if accompanied by warmth or drainage, are classic signs of infection, which can quickly worsen and lead to severe complications. While feeling tired, increased appetite, or requesting blankets are observations worth noting, they are generally less critical than signs of infection at a surgical site. Always prioritize observations that suggest an acute medical problem. Question 11. When providing perineal care for an uncircumcised male resident, the CNA should A. Retract the foreskin, cleanse, and then return the foreskin to its natural position. B. Cleanse around the foreskin but never retract it. C. Use a strong disinfectant to ensure thorough cleaning. D. Ask the resident's family to perform the care. Answer: A. Retract the foreskin, cleanse, and then return the foreskin to its natural position. This question addresses proper hygiene for uncircumcised male residents, which is essential for preventing infection and maintaining skin integrity. The key concept is thorough cleaning while respecting the resident's anatomy. Retracting the foreskin allows for proper cleaning of the glans penis, where secretions and bacteria can accumulate. It is crucial to return the foreskin immediately to its natural position after cleaning to prevent paraphimosis, a painful and serious condition where the foreskin becomes trapped behind the glans. Using strong disinfectants is unnecessary and can cause irritation. For instance, when cleaning, gently pull back the foreskin, wash with mild soap and water, rinse, dry, and then return it. Question 12. A CNA is assisting a resident to dress. The resident becomes agitated and starts to resist. What is the most appropriate action? A. Force the clothing on quickly to get it over with. B. Stop the dressing, give the resident a moment, and try again later. C. Tell the resident they must get dressed now. D. Ask another CNA to help hold the resident still. Answer: B. Stop the dressing, give the resident a moment, and try again later. This question tests the CNA's approach to resident agitation, especially in the context of personal care. The concept is about patient-centered care and de-escalation, avoiding confrontation and respecting the resident's current state. When a resident becomes agitated, forcing the action or using physical restraint can increase their distress and escalate the behavior. Stopping the activity, allowing them to calm down, and attempting the task later or at a different time is a compassionate and effective strategy. For example, if a resident resists bathing, you might say, "It looks like you're not ready for your bath right now. We can try again in a little while." Question 13. Which action best promotes a resident's independence during mealtime? A. Feeding the resident quickly to ensure they eat enough. B. Cutting all the resident's food into small, bite-sized pieces. C. Allowing the resident to choose their own pace and feed themselves as much as possible. D. Placing a protective bib on the resident without asking. Answer: C. Allowing the resident to choose their own pace and feed themselves as much as possible. This question highlights the importance of promoting independence and dignity in activities of daily living, ADLs. The core concept is restorative care, which focuses on helping residents maintain or regain their abilities. Allowing a resident to control their mealtime pace and feed themselves maximizes their autonomy and motor skills, even if it takes longer. Cutting all food might be helpful for some but isn't always necessary for all. Similarly, a bib should be offered, not just placed. Rushing a resident can be distressing and strip them of their self-sufficiency. For instance, offer choices for drinks or let them decide which food item to eat first. Question 14. A resident with diabetes has a small open sore on their foot. What is the CNA's most important action? A. Apply a bandage and antiseptic ointment immediately. B. Elevate the resident's foot to reduce swelling. C. Report the observation to the nurse immediately. D. Encourage the resident to walk to improve circulation. Answer: C. Report the observation to the nurse immediately. This question addresses the critical observation and reporting responsibilities of a CNA, especially for vulnerable residents. The concept being tested is recognizing a potentially serious complication in a resident with a chronic condition like diabetes. Foot sores in diabetic residents can quickly become infected and lead to severe complications, including amputation, due to impaired circulation and nerve damage. Therefore, immediate notification of the nurse is paramount for proper assessment and treatment. A CNA should not attempt to treat the wound beyond basic protective measures, nor should they encourage actions that might worsen it. Always report any skin integrity issues on a diabetic resident without delay. Question 15. What is the primary purpose of hospice care? A. To cure terminal illnesses. B. To provide aggressive medical treatment. C. To focus on comfort and quality of life for terminally ill residents. D. To prepare residents for discharge to their homes. Answer: C. To focus on comfort and quality of life for terminally ill residents. This question defines the core philosophy of hospice care, a crucial aspect of end-of-life support. The primary purpose of hospice is palliative care, which means alleviating suffering and providing comfort, dignity, and emotional support for individuals who have a limited life expectancy, typically 6 months or less. It is not about curing the illness or aggressively treating it, but rather about managing symptoms and enhancing the remaining quality of life. For example, hospice care might include pain management, spiritual counseling, and support for the resident's family. Understanding this distinction helps CNAs provide appropriate and compassionate care to residents nearing the end of life. Question 16. A resident expresses strong refusal to take a shower, stating, "I showered yesterday." What is the best initial response by the CNA? A. Inform the resident that showers are required daily for hygiene. B. Offer an alternative, such as a bed bath or a partial wash. C. Tell the resident you will just give them a quick shower, it won't take long. D. Document the refusal and skip the bath for the day. Answer: B. Offer an alternative, such as a bed bath or a partial wash. This question assesses how a CNA respects resident autonomy while still promoting hygiene. The concept is about finding a balance between resident choice and necessary care, and avoiding confrontation. Forcing a resident can lead to agitation and mistrust. Offering an alternative, like a bed bath or cleaning specific areas, respects their refusal while still addressing hygiene needs. Daily showers are not always medically necessary or desired by every resident, and "I showered yesterday" may indicate memory issues or simple preference. For example, if a resident refuses to brush their teeth, you could offer mouthwash instead. Always seek flexible solutions that maintain dignity. Question 17. The most effective way for a CNA to prevent the spread of C. difficile, Clostridioides difficile, is by A. Using alcohol-based hand sanitizer frequently. B. Wearing gloves for all resident contact. C. Washing hands thoroughly with soap and water. D. Isolating residents with C. difficile in a private room. Answer: C. Washing hands thoroughly with soap and water. This question focuses on specific infection control measures for a highly contagious bacterium. The key concept is understanding that alcohol-based hand sanitizers are ineffective against C. difficile spores. Thorough hand washing with soap and water is essential to physically remove the spores from the hands. While wearing gloves and isolation are important components of C. difficile precautions, they are not the most effective way for the CNA to prevent transmission on their hands. For example, after caring for a C. diff resident, always head to the sink for a vigorous hand wash, even if gloves were worn. Question 18. When assisting a resident who is visually impaired to eat, the CNA should A. Describe the food placement using the clock face method. B. Cut all food into very small pieces and mix them together. C. Feed the resident quickly to ensure they finish. D. Tell the resident to eat up without further guidance. Answer: A. Describe the food placement using the clock face method. This question tests a CNA's ability to provide supportive care for residents with sensory impairments, specifically visual impairment. The clock face method is a practical and widely accepted technique to help visually impaired individuals independently locate items on their plate, promoting dignity and independence. For example, you might say, "Your peas are at 3 o'clock, and your chicken is at 6 o'clock." Cutting all food and mixing it can make it unappetizing and difficult to identify, while rushing or giving vague instructions hinders their ability to eat effectively. Question 19. A resident is experiencing dyspnea. What does this term mean? A. Difficulty swallowing. B. Difficulty breathing. C. Painful urination. D. Severe headache. Answer: B. Difficulty breathing. This question tests common medical terminology that CNAs must understand for accurate observation and reporting. The term dyspnea specifically refers to shortness of breath or labored breathing. Knowing this term allows the CNA to precisely describe a resident's symptom to the nurse, ensuring timely and appropriate intervention. For example, if a resident's chest rises and falls rapidly and they appear to be gasping, they are experiencing dyspnea. Familiarity with medical terms helps in clear communication within the healthcare team. Question 20. What is the most important reason for a CNA to accurately measure and record a resident's intake and output, INO? A. To determine the resident's food preferences. B. To assess the resident's hydration status and kidney function. C. To decide when the resident needs to use the restroom. D. To calculate the resident's daily caloric intake. Answer: B. To assess the resident's hydration status and kidney function. This question highlights the clinical importance of accurate INO measurement. The core concept is fluid balance, which is crucial for overall health and specifically for kidney function. Tracking how much fluid a resident takes in, intake, and how much they eliminate, output, provides vital information to the healthcare team about their hydration levels and potential fluid imbalances, such as dehydration or fluid overload. This data helps in diagnosing and managing various conditions, unlike the other options, which are not the primary purpose of INO monitoring. For example, if intake is significantly less than output, the resident might be dehydrated. Question 21. A CNA finds a resident lying on the floor. What is the immediate first action? A. Attempt to move the resident back to bed immediately. B. Leave the resident to call the nurse. C. Assess the resident for injuries and call for help. D. Document the incident in the resident's chart. Answer: C. Assess the resident for injuries and call for help. This question describes a fall incident, a critical safety scenario for CNAs. The immediate priority after discovering a resident on the floor is to ensure their safety and well-being. Before moving the resident, which could worsen potential injuries like fractures, the CNA must quickly assess them for obvious injuries and call for assistance from a nurse or other staff members. Documenting is important but comes after ensuring immediate safety. For instance, if you find a resident on the floor, first check if they are responsive, bleeding, or complaining of pain, then activate the call light or get help. Question 22. A resident with dysphagia is at high risk for A. Dehydration. B. Skin breakdown. C. Aspiration. D. Depression. Answer: C. Aspiration. This question tests understanding of a specific medical condition and its primary associated risk. Dysphagia means difficulty swallowing, and the most immediate and dangerous complication is aspiration, which is when food or liquid enters the trachea, windpipe, instead of the esophagus, potentially leading to pneumonia or choking. While dehydration and depression can be secondary concerns, aspiration is the direct and most acute risk related to swallowing difficulties. For example, a resident with dysphagia may need thickened liquids or pureed foods to prevent aspiration. Recognizing this risk is crucial for safe feeding practices. Question 23. When weighing a resident, it is most important for the CNA to A. Ensure the resident has just eaten breakfast. B. Use a different scale each time for accuracy. C. Weigh the resident at the same time of day, in the same clothes, or none. D. Allow the resident to hold onto a support bar for balance. Answer: C. Weigh the resident at the same time of day, in the same clothes, or none. This question focuses on the accuracy and consistency of vital measurements, specifically resident weight. The concept is standardizing the procedure to ensure reliable and comparable readings over time. Daily weight fluctuations can occur due to fluid shifts, clothing, or recent food/fluid intake. Weighing at the same time, e.g., morning before breakfast, on the same scale, and with consistent clothing minimizes these variables, providing the most accurate representation of true weight changes. Holding a support bar might affect the reading by partially supporting their weight. Question 24. A CNA is assisting a resident who has expressive aphasia. The best way to communicate with this resident is to A. Speak loudly and quickly to ensure they hear you. B. Use complex sentences to explain procedures thoroughly. C. Ask yes/no questions or use gestures and picture boards. D. Assume the resident understands everything you say without effort. Answer: C. Ask yes/no questions or use gestures and picture boards. This question tests communication strategies for residents with specific communication impairments. Expressive aphasia means difficulty expressing thoughts, even though understanding might be intact. The concept is about adapting communication methods to the resident's abilities. Using simple, direct yes/no questions, gestures, or visual aids reduces the cognitive load and allows the resident to respond more easily, promoting effective communication and reducing frustration. Speaking loudly, quickly, or using complex sentences would only hinder their ability to process and respond. For example, instead of asking, "What would you like for lunch?" you could point to options and ask, "Juice or milk?" Question 25. The medical term for low blood sugar is A. Hyperglycemia, B. Hypertension, C. Hypoglycemia, D. Hypotension. Answer: C. Hypoglycemia. This question assesses knowledge of basic medical terminology, specifically related to blood sugar levels. Hypoglycemia is the precise medical term for low blood sugar, which is a critical condition, especially for residents with diabetes, that requires immediate attention. Hyperglycemia is high blood sugar, and hypertension and hypotension refer to high and low blood pressure, respectively. Understanding these terms is crucial for a CNA to recognize symptoms and report accurately. For example, symptoms of hypoglycemia can include shakiness, sweating, and confusion. Question 26. When assisting a resident with range of motion (ROM) exercises, the CNA should A. Move the joint past the point of pain to increase flexibility. B. Perform exercises quickly to complete them efficiently. C. Support the joint above and below the area being moved. D. Discontinue exercises if the resident expresses any discomfort. Answer: C. Support the joint above and below the area being moved. This question focuses on the proper and safe technique for performing range of motion exercises. The core concept is protecting the joint and preventing injury during movement. Supporting the joint above and below the area being moved provides stability, reduces strain on the joint itself, and prevents hyperextension or twisting. Moving past the point of pain or performing exercises quickly can cause injury, and while discomfort should be noted and reported, minor discomfort doesn't always mean discontinuing all exercises. Rather, it suggests adjusting the movement or reporting it to the nurse. For example, when moving the knee, support the thigh and the calf. Question 27. What is the correct term for the loss of ability to control bladder or bowel function? A. Incontinence, B. Constipation, C. Diarrhea, D. Edema. Answer: A. Incontinence. This question tests basic medical terminology related to bodily functions. Incontinence is the specific medical term referring to the involuntary loss of urine, urinary incontinence, or feces, fecal incontinence. Understanding this term is fundamental for CNAs when documenting, discussing, and providing care for residents who experience this common issue. Constipation, diarrhea, and edema describe other specific conditions that are not a general loss of control. For example, if a resident has frequent involuntary urine leakage, they are experiencing urinary incontinence. Question 28. A resident has a call light within reach but is not using it despite needing assistance. The CNA should A. Assume the resident does not need help. B. Periodically check on the resident and anticipate needs. C. Remind the resident frequently to use the call light. D. Wait until the resident calls for help. Answer B. Periodically check on the resident and anticipate needs. This question addresses proactive resident care and observation, especially when residents may not be able to effectively use their call light. The concept is about understanding that not all residents, especially those with cognitive impairments or weakness, will consistently use their call light, even if it's within reach. Therefore, regular checks and anticipating their needs, e.g., offering toileting assistance every 2 hours, are crucial for safety and comfort. Simply reminding them or waiting for a call light that may never be pressed is not sufficient care. For example, if a resident is known to be a fall risk, regular rounding prevents them from attempting to get up unassisted. Question 29. A CNA observes that a resident's urine is dark amber and has a strong odor. This might indicate A. Overhydration, B. Dehydration, C. A bladder infection, D. Recent intake of certain medications. Answer B. Dehydration. This question focuses on interpreting common signs and symptoms related to fluid balance. Dark amber urine with a strong odor is a classic indicator of dehydration, meaning the resident is not consuming enough fluids. When the body is dehydrated, the kidneys conserve water, making the urine more concentrated. While a bladder infection can also cause a strong odor, it's usually accompanied by cloudiness or pain, and dark color primarily points to dehydration. For instance, if a resident's urine looks like apple juice, it's a sign they need more fluids. Question 30. Which of the following is considered an ethical responsibility of a CNA? A. Performing sterile procedures independently. B. Maintaining confidentiality of resident information. C. Diagnosing resident illnesses. D. Administering intravenous medications. Answer B. Maintaining confidentiality of resident information. This question centers on the ethical and legal responsibilities inherent in healthcare. The concept of confidentiality, often referred to as HIPAA, Health Insurance Portability and Accountability Act, is paramount in protecting resident privacy and trust. CNAs have access to sensitive personal and medical information, and they are ethically and legally bound to keep this information private and only share it with authorized personnel on a need-to-know basis. Performing sterile procedures, diagnosing illnesses, or administering 4 medications are all outside the CNA's scope of practice. For example, a CNA should never discuss a resident's condition or personal details with family members or visitors without explicit permission or with other staff members not directly involved in their care. Question 31. A resident has experienced a stroke and has right-sided paralysis. When assisting with dressing, the CNA should first put clothing on the A. Right, affected, arm/leg. B. Left, unaffected, arm/leg. C. Head, then arms and legs. D. It does not matter which side goes first. Answer A. Right, affected, arm/leg. This question addresses proper dressing techniques for residents with hemiplegia, paralysis of one side of the body. The key concept is dress the weak side first, which is a standard principle to promote comfort, ease, and prevent injury. By dressing the affected side first, you can guide the limb into the clothing more easily without having to maneuver it through the garment after the strong side is already in. Undressing is the opposite, undress the strong side first. For example, if a resident has left-sided weakness, you would put the shirt sleeve on the left arm first. Question 32. What is the correct way to identify a resident before providing care? A. Ask, "Are you Mr. Smith?" B. Check the resident's room number. C. Check the resident's identification band and state their name aloud. D. Ask the resident's roommate to identify them. Answer C. Check the resident's identification band and state their name aloud. This question emphasizes patient safety, specifically correct resident identification. The concept is to use at least 2 unique identifiers before providing any care or administering anything to a resident, as mandated by safety protocols. Checking the identification band and stating the resident's name aloud allows for verification against the care plan and gives the resident an opportunity to confirm or correct. Simply asking, "Are you Mr. Smith?" which they might agree to even if confused, relying on room number alone, or asking a roommate is unreliable and unsafe. For instance, before giving a resident a meal tray, always check their ID band and confirm their name and birth date. Question 33. A CNA notices a strong fruity odor on a resident's breath. This could be a sign of A. Hypoglycemia, B. Dehydration, C. Hyperglycemia, D. Heart attack. Answer C. Hyperglycemia. This question assesses the CNA's ability to recognize symptoms associated with specific medical conditions. A fruity odor on the breath, often described as sweet or like nail polish remover, is a classic sign of diabetic ketoacidosis, DKA, a serious complication of uncontrolled hyperglycemia, high blood sugar. This occurs when the body starts breaking down fat for energy, producing ketones that cause the distinct odor. Hypoglycemia would typically present with shakiness and sweating, not a fruity breath. For example, if a resident also complains of increased thirst and frequent urination, coupled with fruity breath, report it immediately to the nurse. Question 34. What is the most important reason to reposition a bedridden resident at least every 2 hours? A. To ensure they get enough sleep. B. To prevent the development of pressure injuries, bed sores. C. To improve their appetite. D. To keep their joints flexible. Answer B. To prevent the development of pressure injuries, bed sores. This question focuses on preventative care for immobile residents. The concept is that prolonged pressure on bony prominences can restrict blood flow, leading to tissue damage and the formation of pressure injuries, also known as bed sores or decubitus ulcers. Regular repositioning, typically every 2 hours, redistributes pressure, maintains circulation, and is the most effective way to prevent these painful and dangerous skin breakdowns. While it may indirectly aid sleep or joint flexibility, the primary and most critical reason is skin integrity. For instance, when turning a resident, ensure their weight is distributed evenly and use pillows to support their limbs. Question 35. When caring for a resident with an ostomy, the CNA should report what observation to the nurse immediately? A. The stoma is reddish pink and moist. B. The resident expresses concern about body image. C. There is no stool output from the stoma for 24 hours. D. The resident is learning to change their own ostomy pouch. Answer C. There is no stool output from the stoma for 24 hours. This question targets critical observations related to ostomy care. The keyword immediately points to a potentially serious complication. A healthy stoma, the surgically created opening, should produce output regularly. An absence of stool for 24 hours can indicate a bowel obstruction, which is a medical emergency requiring urgent intervention. A reddish pink, moist stoma is actually a sign of a healthy stoma. While body image concerns and learning self-care are important, they are not immediate medical emergencies. For example, if an ostomy stops functioning, it can lead to severe abdominal pain and distension. Question 36. What is the best way to maintain a resident's privacy while providing care? A. Pull the privacy curtain and close the door if possible. B. Announce loudly that you are about to provide care. C. ensure the resident's roommate is not in the room. D. Perform care quickly to minimize exposure. Answer: A. Pull the privacy curtain and close the door if possible. This question emphasizes the fundamental resident right to privacy and dignity during care. The concept is about creating a private environment to protect the resident's modesty and personal space. Drawing the privacy curtain and closing the door, if feasible, physically shields the resident from view and helps to minimize noise, ensuring their personal care remains a private matter. Announcing loudly or simply rushing through care does not adequately protect privacy. For example, before assisting with a bed bath, always ensure the resident is fully draped and the privacy curtain is drawn. Question 37. Which of the following symptoms should a CNA immediately report to the nurse when caring for a resident with a cast on their arm? A. Slight itching under the cast. B. The resident states the cast feels a bit tight. C. Fingers on the affected hand are swollen, cold, and pale. D. The resident asks for a pen to sign the cast. Answer: C. Fingers on the affected hand are swollen, cold, and pale. This question focuses on critical observations for residents with casts. The keywords swollen, cold, and pale point to potential circulatory impairment, which is a medical emergency known as compartment syndrome or neurovascular compromise. This occurs when pressure inside the cast cuts off blood flow and nerve function, leading to permanent damage if not addressed quickly. Slight itching or a request for signing are minor, and while a cast feeling a bit tight should be noted, extreme signs like cold, pale, and swollen digits are far more critical. For instance, always check 4-5 PS, pain, pallor, paleness, paresthesia, numbness/tingling, pulselessness, and paralysis in the limb with the cast. Question 38. A resident is refusing breakfast. The CNA's best initial action is to: A. Force the resident to eat a few bites for nutrition. B. Document the refusal and skip the meal entirely. C. Ask the resident why they are refusing and offer alternatives. D. Report the refusal to the doctor immediately. Answer: C. Ask the resident why they are refusing and offer alternatives. This question addresses resident refusal of meals, a common scenario in long-term care. The concept is about person-centered care and problem-solving before immediate escalation. Asking why helps uncover underlying issues, e.g., pain, nausea, food dislike, desire for a different option. Offering alternatives respects their autonomy and may encourage intake. Forcing food is abusive, and immediately skipping the meal without attempting to understand or resolve the issue means missed opportunity for nutrition. For example, if they say they don't like eggs, offer toast or cereal instead. Question 39. What is the appropriate response if a resident with a history of falls attempts to get out of bed without assistance? A. Yell no, to stop them from falling. B. Immediately assist the resident back into bed. C. Guide them gently back to a seated position and reinforce safety. D. Block their path to prevent them from standing. Answer: C. Guide them gently back to a seated position and reinforce safety. This question assesses the CNA's immediate response to a resident attempting an unsafe transfer. The concept is to prioritize safety without causing alarm or escalation. Yelling can startle and potentially cause a fall. Physically blocking them or forcing them back can cause injury or agitation. Gently guiding them back down and calmly reminding them about safety and the call light helps reinforce the correct procedure while keeping them safe. For instance, if you see a resident starting to stand, place a gentle hand on their arm and say, "Let me help you, please sit back down for a moment." Question 40. When assisting a resident who uses a cane, the CNA should encourage the resident to: A. Move the cane and then the strong leg, followed by the weak leg. B. Move the cane and the weak leg together, then the strong leg. C. Use the cane on their strong side for better support. D. Swing the cane forward and walk quickly. Answer: B. Move the cane and the weak leg together, then the strong leg. This question relates to proper use of assistive devices for ambulation. The concept is to provide maximum stability and support for the weaker side. The cane should always move forward with the weak leg to provide immediate support as that leg advances. Placing the cane on the strong side or moving it out of sync with the weak leg would undermine its purpose for support and balance. For example, if a resident has a weak right leg, the sequence would be cane and right leg together, then the left leg. Question 41. A resident has a new order for NPO after midnight. What does NPO mean? A. Nothing by mouth. B. No pain medication. C. Nurse to provide oxygen. D. Normal physical activity permitted. Answer: A. Nothing by mouth. This question tests essential medical abbreviations and terms that CNAs encounter daily. NPO is a widely used medical abbreviation derived from the Latin nil per os, meaning nothing by mouth. This order is critical for resident safety, especially before surgeries or certain diagnostic tests, as consuming food or liquids could lead to complications like aspiration. For instance, if a resident is NPO after midnight, they should not be given water, ice chips, or food until the order is changed. Question 42. Which of the following is the best way to prevent falls in a long-term care facility? A. Keeping side rails up on all beds. B. Requiring all residents to use wheelchairs. C. Ensuring call lights are within reach and residents are checked frequently. D. Limiting resident activity to stay in their rooms. Answer: C. Ensuring call lights are within reach and residents are checked frequently. This question addresses comprehensive fall prevention strategies. The concept is about proactive and person-centered safety measures that balance safety with resident autonomy. Keeping call lights accessible and routinely checking on residents allows them to summon help when needed and anticipates needs, like toileting, reducing the urge to get up unassisted. Relying solely on side rails, which can be a restraint, confining residents to wheelchairs, or limiting activity are restrictive and can actually increase agitation and fall risk or reduce quality of life. For example, regularly toileting residents reduces the urge for them to try to get up independently to use the bathroom. Question 43. A resident's cultural background includes a preference for family members to provide personal care. What is the CNA's most appropriate response? A. Insist on providing the care to ensure facility standards are met. B. Inform the family that facility policy requires staff to provide all care. C. Discuss this preference with the nurse to see how it can be accommodated. D. Document the refusal and avoid providing any personal care to the resident. Answer: C. Discuss this preference with the nurse to see how it can be accommodated. This question addresses cultural sensitivity and person-centered care. The concept is about respecting a resident's cultural and personal preferences while still ensuring their needs are met within the facility's framework. Instead of insisting or outright refusing, the CNA's role is to act as a liaison, reporting the preference to the nurse. The nurse can then determine if and how the request can be accommodated, potentially by collaborating with the family or adjusting the care plan. For example, if a resident prefers specific prayer times, the CNA would report this to the nurse for scheduling adjustments. Question 44. The purpose of a restorative nursing program is to A. Provide all care for residents to ease their burden. B. Help residents maintain or regain their highest level of functioning. C. Prepare residents for immediate discharge from the facility. D. Focus solely on providing comfort measures for terminal residents. Answer: B. Help residents maintain or regain their highest level of functioning. This question defines the core goal of restorative nursing care. The concept is about rehabilitation and promoting independence rather than simply providing custodial care. Restorative programs aim to prevent further decline, improve existing abilities, and help residents achieve their optimal level of physical, mental, and psychosocial functioning, often after an illness or injury. It is not about doing everything for them, but empowering them to do as much as possible for themselves. For example, assisting a resident to dress themselves, even if it takes longer, is part of restorative care. Question 45. A CNA is taking a resident's pulse and notes it is very irregular. The most appropriate action is to A. Take the pulse again immediately using the same method. B. Document the irregular pulse and report it to the nurse. C. Tell the resident not to worry, it is normal. D. Take the resident's blood pressure instead. Answer: B. Document the irregular pulse and report it to the nurse. This question focuses on vital sign assessment and reporting. The concept is that an irregular pulse can be a significant indicator of an underlying cardiac issue, requiring professional evaluation. While taking it again can confirm the finding, the immediate priority after observation is to document the finding accurately and then report it to the nurse, who can then assess further and determine appropriate action. Reassuring the resident that it's normal or taking another vital sign instead of reporting the critical finding is inappropriate and delays necessary medical attention. For example, if a resident's pulse is skipping beats, this needs to be reported for potential arrhythmias. Question 46. What is the correct procedure for emptying a urinary drainage bag? A. Empty it only when it is completely full. B. Disconnect the drainage bag from the catheter before emptying. C. Measure the urine, then empty it into the toilet without touching the spout to the toilet rim. D. Wear sterile gloves while emptying the bag. Answer: C. Measure the urine, then empty it into the toilet without touching the spout to the toilet rim. This question outlines proper infection control and measurement techniques for urinary drainage bags. The concept is to prevent contamination and ensure accurate intake/output monitoring. Measuring the urine is crucial for INO records. Emptying the bag into the toilet without letting the spout touch the rim prevents cross-contamination of the clean spout with toilet germs. The bag should be emptied regularly, not just when full, to prevent reflux and reduce strain on the tubing. While clean gloves are used, sterile gloves are not typically required for emptying the bag unless otherwise specified. Question 47. A resident starts choking while eating. The CNA's first action should be to A. Call for the nurse immediately. B. Perform abdominal thrusts, Heimlich maneuver. C. Offer the resident a drink of water. D. Encourage the resident to cough strongly. Answer: D. Encourage the resident to cough strongly. This question describes a choking incident, a medical emergency. The concept is to differentiate between partial and complete airway obstruction and to apply the appropriate first aid. If a resident is coughing, it means air is still moving, and they have a partial obstruction. Encouraging them to cough is the most effective initial action to dislodge the object themselves. Only if the resident cannot cough, speak, or breathe, indicating a complete obstruction, should abdominal thrusts be performed. Offering water could worsen the obstruction. Question 48. When assisting a resident with personal hygiene, the CNA should prioritize A. Completing the task as quickly as possible. B. Allowing the resident to do as much as they can independently. C. Using very hot water to ensure cleanliness. D. Keeping the resident fully exposed for better access. Answer: B. Allowing the resident to do as much as they can independently. This question emphasizes the principle of resident-centered care and promotion of independence during activities of daily living. The concept of restorative care encourages CNAs to enable residents to participate in their own care to the fullest extent possible, rather than doing everything for them. This maintains their dignity, self-esteem, and physical function. Rushing, using excessively hot water, or full exposure compromises dignity and safety. For example, if a resident can wash their own face and arms, provide the supplies and let them do it, offering help only as needed. Question 49. A resident is complaining of pain. What is the most important information for the CNA to obtain and report to the nurse? A. If the resident has asked for pain medication before. B. The exact location, intensity, on a scale of 0 to 10, and type of pain. C. The resident's family history of pain. D. If the resident is exaggerating the pain. Answer: B. The exact location, intensity, on a scale of 0 to 10, and type of pain. This question focuses on effective pain assessment and reporting. The concept is that comprehensive and specific information about pain helps the nurse accurately assess the resident's condition and administer appropriate pain relief. Location, intensity, and type, e.g., dull ache, sharp, throbbing, are key components of a thorough pain assessment. Other options are either irrelevant to immediate pain management or involve subjective judgment by the CNA, which is inappropriate. For example, ask, "Where does it hurt?" How bad is it on a scale of 0 to 10? What does it feel like? Question 50. What is the most important reason to wear gloves when handling soiled linens? A. To protect the linens from contamination. B. To prevent the spread of microorganisms. C. To keep hands from getting wet. D. To meet facility laundry protocols. Answer: B. To prevent the spread of microorganisms. This question tests the understanding of standard precautions in infection control. The primary reason for wearing gloves when handling soiled items, including linens, is to create a barrier that prevents the transmission of microorganisms from the contaminated items to the CNA's hands, and subsequently, to other residents or surfaces. Soiled linens can contain various pathogens from bodily fluids. While keeping hands dry might be a benefit, the overwhelming reason is infection prevention. For example, even if linens appear only slightly soiled, gloves are still required as unseen pathogens may be present. Question 51. When assisting a resident who is confused, the CNA should avoid: A. Providing a consistent routine. B. Using simple, clear language. C. Arguing or reasoning with the resident. D. Orienting the resident to person, place, and time. Answer: C. Arguing or reasoning with the resident. This question addresses effective communication strategies for residents with confusion or cognitive impairment. The concept is that arguing or trying to reason logically with a confused resident is usually ineffective, can increase their agitation, and create frustration for both the resident and the caregiver. Instead, it's more beneficial to validate their feelings, redirect them, or use therapeutic fibbing if appropriate, focusing on their emotional well-being rather than factual accuracy. A consistent routine, simple language, and reorientation, when appropriate and gentle, are all helpful. For example, if a resident insists it's 1950, you might respond, "You're thinking of a long time ago. It's Tuesday, and we're going to have lunch now." Question 52. What is the correct way to handle a resident's dentures after cleaning? A. Store them dry in a tissue. B. Place them in a labeled cup of clean, cool water or denture solution. C. Wrap them in a paper towel and leave them on the bedside table. D. Boil them to ensure they are fully sanitized. Answer: B. Place them in a labeled cup of clean, cool water, or denture solution. This question tests proper care for a resident's personal belongings, specifically dentures. The concept is to maintain the integrity and hygiene of the dentures while preventing loss. Dentures must be kept moist when not in the resident's mouth to prevent warping and cracking. Storing them dry, in a tissue, or on the bedside table can damage them or lead to loss. Boiling them can melt or distort the plastic. For example, always use a labeled container with water or denture solution when dentures are removed for cleaning or during sleep. Question 53. A resident's care plan indicates they are on fluid restrictions. What does this mean? A. The resident should not have any fluids at all. B. The resident's fluid intake must be limited to a specific amount. C. The resident can have any fluids they want, but only at specific times. D. The resident must drink extra fluids. Answer: B. The resident's fluid intake must be limited to a specific amount. This question tests understanding of common dietary and fluid orders. Fluid restrictions mean that the total amount of liquids a resident can consume within a 24-hour period is limited to a specific volume, typically ordered by a doctor to manage conditions like heart failure or kidney disease. It does not mean no fluids at all or unlimited fluids. The CNA must carefully measure and document all fluid intake to ensure the restriction is met. For example, if a resident is on a 1,500 milliliters fluid restriction, every drink, ice chip, or liquid food item counts towards that total. Question 54. When assisting a resident with a catheter, what is the most important observation to report to the nurse? A. The resident complains of hunger. B. The urine in the bag is cloudy and has a strong odor. C. The resident's favorite TV show is on. D. The drainage bag is nearly full. Answer: B. The urine in the bag is cloudy and has a strong odor. This question focuses on critical observations related to urinary catheters. The concept is to identify signs of potential complications, specifically a urinary tract infection, UTI. Cloudy urine and a strong odor are classic indicators of a UTI, which can be serious, especially for catheterized residents. While a full drainage bag needs to be emptied, and other observations may be noted, signs of infection are much more immediately concerning. For example, if a resident with a catheter also develops a fever, these signs combined strongly suggest an infection. Question 55. What is the appropriate temperature range for bath water when assisting a resident? A. 90 to 95 degrees Fahrenheit, 32.2 to 35 degrees Celsius. B. 100 to 105 degrees Fahrenheit, 37.8 to 40.6 degrees Celsius. C. 110 to 115 degrees Fahrenheit, 43.3 to 46.1 degrees Celsius. D. As hot as the resident prefers. Answer: B. 100 to 105 degrees Fahrenheit, 37.8 to 40.6 degrees Celsius. This question focuses on resident safety during bathing. The concept is to ensure the water temperature is warm enough for comfort but not so hot as to cause burns, especially since many residents have reduced sensation due to age or medical conditions. The range of 100 to 105 degrees Fahrenheit is generally considered safe and comfortable for a bath. Temperatures higher than this significantly increase the risk of scalding, and as hot as the resident prefers is unsafe, as their sensation may be impaired. For example, always check the water temperature with a thermometer or your inner wrist before allowing the resident to enter the tub or shower. Question 56. The most effective way to prevent aspiration during oral care for an unconscious resident is to A. Place the resident in a supine, flat on back, position. B. Use copious amounts of mouthwash. C. Turn the resident on their side with their head turned to the side. D. Skip oral care to avoid risk. Answer: C. Turn the resident on their side with their head turned to the side. This question addresses a critical safety measure for unconscious residents during oral hygiene. The primary concept is preventing aspiration, where fluids or debris enter the lungs. By turning the resident on their side with their head turned, gravity helps any excess liquid or debris drain out of the mouth, rather than being swallowed or aspirated into the airway. Performing oral care in a supine position or using excessive liquids significantly increases aspiration risk. For example, after cleaning, ensure all fluid is removed and the resident is still positioned safely. Question 57. A CNA is asked to measure a resident's height. Which instruction should the CNA follow for accuracy? A. Measure the resident while they are lying in bed. B. Ask the resident to stand as tall as possible without shoes. C. Measure the resident while they are wearing their shoes. D. Use a flexible tape measure to account for posture. Answer: B. Ask the resident to stand as tall as possible without shoes. This question focuses on accurate measurement techniques for resident height. The concept is to obtain the most precise measurement possible, as height is a crucial part of a resident's baseline data and can influence medication dosages or equipment sizing. Measuring height while standing tall and without shoes removes variables that can alter the measurement, such as shoe thickness or bed sagging. For example, guide the resident to stand straight with their heels against the wall or measuring device. Question 58. The term cyanosis refers to A. Redness of the skin. B. Yellowing of the skin. C. Bluish discoloration of the skin, lips, or nail beds. D. Pale skin. Answer: C. Bluish discoloration of the skin, lips, or nail beds. This question tests knowledge of medical terminology related to skin color, which can be an important indicator of a resident's oxygenation. Cyanosis specifically means a bluish or grayish discoloration of the skin, mucous membranes, or nail beds, typically caused by a lack of oxygen in the blood. Recognizing this sign is critical as it indicates a serious respiratory or circulatory problem requiring immediate nursing attention. The other options describe different skin conditions. For instance, if a resident's lips appear blue, it's a sign of cyanosis. Question 59. When transferring a resident from a bed to a wheelchair, the CNA should use a gait belt. A. Only if the resident asks for it. B. Around the resident's waist, over their clothing. C. Under the resident's arms. D. Only if the resident is very heavy. Answer: B. Around the resident's waist, over their clothing. This question focuses on safe transfer techniques using a gait belt. The concept is to apply the gait belt correctly for maximum safety and support. A gait belt should be placed securely around the resident's waist, over their clothing, to provide a firm grasp for the CNA during transfers or ambulation. Placing it under the arms can cause injury to the resident's armpits or chest, and it should be used for all residents who need assistance with standing or walking, regardless of their weight, unless contraindicated. For example, before helping a resident stand from a chair, securely fasten the gait belt around their waist. Question 60. A resident becomes combative during care. The CNA should A. Restrain the resident immediately. B. Shout at the resident to stop. C. Step back, ensure safety, and call for help. D. Continue care quickly to finish the task. Answer: C. Step back, ensure safety, and call for help. This question addresses how to respond to resident aggression or combativeness. The immediate priority is the safety of both the resident and the CNA. When a resident becomes combative, the CNA should not escalate the situation by shouting or trying to force care. Instead, stepping back to create distance, ensuring that both are safe from harm, and then calling for assistance from another staff member or the nurse allows for a calmer, more controlled intervention. For instance, if a resident tries to hit you during dressing, calmly move out of reach and activate the call light for assistance. Question 61. What is the best way to prevent a urinary tract infection, UTI, in a female resident? A. Encourage daily bubble baths. B. Wipe the perineal area from back to front after toileting. C. Encourage liberal fluid intake and wipe from front to back. D. Discourage fluid intake to reduce bathroom trips. Answer: C. Encourage liberal fluid intake and wipe from front to back. This question focuses on preventative measures for common infections. The concept is about proper hygiene and hydration to prevent bacteria from entering the urinary tract. Encouraging liberal fluid intake helps flush bacteria from the bladder, and wiping from front to back prevents bacteria from the anal area from entering the urethra. Wiping from back to front or bubble baths can actually increase the risk of UTIs by introducing bacteria. For example, always remind female residents to wipe from the front toward the back after using the toilet. Question 62. Which action by a CNA promotes a resident's right to personal choice? A. Insisting the resident wear the clothes chosen by the CNA. B. Allowing the resident to choose what they want to eat from the menu. C. Deciding the resident's daily activities without their input. D. Keeping the resident's room arranged exactly as the CNA prefers. Answer: B. Allowing the resident to choose what they want to eat from the menu. This question highlights a fundamental resident right, the right to personal choice and self-determination. The concept is about empowering residents to make decisions about their daily lives whenever possible, fostering dignity and independence. Offering choices, such as what to eat, what to wear, or how to spend their time, respects their autonomy. Insisting on choices made by staff or arranging their room without input disregards their preferences. For example, instead of just handing them a specific outfit, offer 2 options and let them pick. Question 63. A resident's respiration rate is 8 breaths per minute. This is considered A. Normal. B. Bradypnea. C. Tachypnea. D. Apnea. Answer: B. Bradypnea. This question tests knowledge of normal vital sign ranges and related medical terminology. The normal adult respiration rate is typically 12 to 20 breaths per minute. Bradypnea refers to an abnormally slow breathing rate, below 12 breaths per minute, which can be a concerning sign requiring immediate reporting to the nurse. Tachypnea is rapid breathing, and apnea is the absence of breathing. For instance, if a resident's breathing is unusually slow or shallow, it's important to report it for immediate evaluation. Question 64. What is the primary reason for encouraging residents to sit upright for 30 minutes after meals? A. To help them fall asleep more easily. B. To prevent aspiration and aid digestion. C. To encourage social interaction in the dining area. D. To allow staff to clean tables more efficiently. Answer: B. To prevent aspiration and aid digestion. This question addresses a critical safety and comfort measure after meals. The concept is that remaining upright uses gravity to help food move down the esophagus and into the stomach, significantly reducing the risk of aspiration, food or liquid entering the lungs, and aiding the digestive process. Lying down too soon after eating can lead to reflux or aspiration, especially in residents with swallowing difficulties or gastric issues. For example, after helping a resident finish their meal, encourage them to stay sitting in their chair or upright in bed for at least 30 minutes. Question 65. The term incontinent refers to A. A resident who is always angry. B. A resident who cannot control their bladder or bowels. C. A resident who is often confused. D. A resident who is frequently dehydrated. Answer: B. A resident who cannot control their bladder or bowels. This question revisits basic medical terminology. Incontinent, or incontinence for the condition, specifically describes the involuntary loss of bladder or bowel control. This is a common challenge for many residents, and CNAs frequently provide care related to this condition. Understanding the term is crucial for proper documentation and communication regarding resident needs. While anger, confusion, or dehydration can affect a resident, they are not defined by the term incontinent. For example, if a resident often has urine leakage, they are incontinent of urine. Question 66. A CNA notices a resident has new swelling in their ankles and feet. This observation should be reported to the nurse because it could indicate A. A need for new shoes. B. Improved circulation. C. Fluid retention or heart problems. D. Normal aging. Answer: C. Fluid retention or heart problems. This question focuses on interpreting physical signs that may indicate a serious medical condition. New or increased swelling in the ankles and feet, known as edema, is a classic symptom of fluid retention, often associated with congestive heart failure, kidney disease, or circulatory issues. This is a significant change that requires immediate nursing assessment. It is not normal aging, a sign of improved circulation, or simply a need for new shoes. For example, if you press on the swollen area and an indentation remains, it is called pitting edema and definitely needs to be reported. Question 67. The best way for a CNA to communicate with a resident who has a hearing impairment is to A. Shout loudly to ensure they hear you. B. Speak slowly and clearly, facing the resident, in a lower pitch. C. Use complex sentences to explain things in detail. D. Turn on the TV or radio louder to stimulate their hearing. Answer: B. Speak slowly and clearly, facing the resident, in a lower pitch. This question tests effective communication strategies for residents with sensory deficits. The concept is to adapt communication methods to the resident's needs. Speaking slowly and clearly, with your face visible, allows the resident to read lips and process words more easily. A lower pitch is often easier for individuals with hearing loss to perceive than a high pitch. Shouting can distort words and be startling, while complex sentences or loud background noise hinder understanding. For example, before speaking, get the resident's attention by gently touching their arm and making eye contact. Question 68. Before placing a resident in a wheelchair, the CNA must ensure the A. Wheels are unlocked. B. Footrests are removed or folded up. C. Resident is wearing socks only. D. Wheelchair is facing away from the bed. Answer: B. Footrests are removed or folded up. This question focuses on safety precautions during transfers using a wheelchair. The concept is to prevent trips, falls, and injuries during the transfer process. When transferring a resident into or out of a wheelchair, the footrests should always be removed or folded up to prevent the resident's feet from getting caught on them, which could cause a fall. Additionally, the wheels must be locked to prevent the chair from rolling. While proper footwear is important, socks only is unsafe. For example, always check that the wheelchair brakes are locked and the footrests are out of the way before the resident attempts to sit or stand. Question 69. What is the most important reason to maintain a resident's body alignment when they are in bed or a chair? A. To keep them looking neat and tidy. B. To prevent pressure injuries, contractures, and respiratory problems. C. To make it easier for the CNA to move them. D. To encourage them to fall asleep. Answer: B. To prevent pressure injuries, contractures, and respiratory problems. This question addresses the fundamental importance of proper body positioning for immobile or semi-mobile residents. The concept is that maintaining good body alignment distributes weight evenly, prevents sustained pressure on bony areas, and keeps joints in a natural position to avoid stiffness and permanent deformities, contractures. It also aids breathing by preventing lung compression. While aesthetics might be a minor benefit, the primary reasons are directly related to preventing severe complications. For example, using pillows to support a resident's limbs in proper alignment helps prevent foot drop or hip rotation. Question 70. A resident is refusing their evening medication. The CNA's best initial action is to A. Crushing the medication and mixing it in food without telling them. B. Document the refusal and report it to the nurse. C. Tell the resident they must take the medication because the doctor ordered it. D. Inform the family about the refusal immediately. Answer: B. Document the refusal and report it to the nurse. This question pertains to resident rights and the CNA's scope of practice regarding medication. The concept is that residents have the right to refuse treatment, and CNAs are not authorized to administer medications or force them. The CNA's responsibility is to respect the refusal, document it accurately, and promptly report it to the nurse. The nurse will then assess the situation, explain the importance of the medication, or contact the doctor for alternative orders. Crushing medication without consent is unethical and against policy. For example, if a resident refuses their pill, simply note the refusal and tell the nurse so they can address it.